Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Today there are no new cases of COVID-19 to report. Our total number of cases remains at 290. 4 individuals are currently hospitalized and there's 1 person in ICU. 251 individuals are listed as recovered and there are 32 active cases. Yesterday, 527 lab tests were performed and the total to date is 31,946. The long weekend is coming and weather is looking favorable, so a lot of people will be thinking about heading out camping or to the cabin this weekend. So we want to make sure Manitobans stay safe when they do so. You know, ensure that you're taking everything you need with you to avoid making extra stops along the way. Limit your close, prolonged contact with others, and for camping, for cottage, for work, for going out, period. If you're ill, you need to be staying home. This is important for our move forward to reopen things gradually and cautiously. It's paramount that Manitobans do not go out when they're feeling ill. Certainly contact healthcare provider, contact health links if you have questions, but we can't have Manitobans out when they're ill. Don't go to work, don't go to school, certainly don't go to the lake, don't go to the cabin if you're feeling ill. If you're out at the lake, continue to practice social distancing, maintain those group levels, certainly below 10, but trying to maintain those 2 meters of separation. And just continue to stay safe to decrease the chances of spreading this virus. We encourage all Manitobans to get tested for COVID-19 should they be having any symptoms. So any respiratory symptoms, cough, runny nose, sore throat, fever. I suggest you attend for testing for COVID-19. Even if the symptoms are mild, even if you're not sure, attend for testing. It's vital to our opening strategy that we find cases early, have people isolating, and do contact investigations. So we really want Manitobans who are having any symptoms of COVID-19 to be tested. So we are well into our first phase of the reopen strategy, and we continue to follow our numbers closely. Manitobans are staying safe, are still practicing physical distancing. Businesses are operating in a safe manner, and so we're going to continue to follow these numbers with the hope of further loosening some of these restrictions over time. But we continue to emphasize that this is not a return to normal, that this virus is still circulating our communities. We're still at risk for the importation of this virus as well. So that's why we want Manitobans to limit any personal non-essential travel. And remind anyone entering Manitoba from outside of Manitoba that they are subject to 14-day self-isolations. These actions that we take over the next weeks to months are going to be vital in our success to getting back to our new normal. And Manitobans are already well versed in the things that we need to do. We need to be staying home when we're ill, and that's really vital. Frequent hand washing, disinfecting frequently touched surfaces, and maintaining that physical distancing as much as possible. In addition to all of those, people may choose to wear a non-medical mask in public, and again, that this doesn't protect the wearer of the mask, it protects the people around them. It shouldn't be a substitute for any of those protective measures we just mentioned, but it is an option going forward. Our message to those that are at high risk of severe outcomes to COVID-19 is to be extra safe. So those over age 65, those with underlying medical conditions, especially respiratory and cardiac conditions, those with immune compromise, really need to take extra caution. The people around them need to take extra caution. Staying home for the most part, going out for essential reasons, making sure you're washing your hands frequently, as well as that physical distancing at all times. You need to really protect those at increased risk of the severe outcomes. Businesses that have questions about the orders can contact engagemb.ca. And as you know, Manitobans can continue to go to our website, manitoba.ca/COVID-19 for up-to-date information. So once again, thanks to everyone, and I'm going to pass it over to Lanette.
Good afternoon, everyone. I'm Lanette Siragusa, Chief Nursing Officer from Shared Health. And earlier this week, we recognized that it is National Nurses Week, and we also acknowledged the importance of our allied health teams and all the support people, how we work together and fight against this COVID-19. So today, though, I would like to make a special recognition that it is Indigenous Nurses Day. And throughout our province, Indigenous nurses are working as leaders, partners, and tireless advocates, not just on First Nations communities, but throughout the province. And I want to take a moment to say thank you to those nursing leaders for everything that you do every day, but especially during this unprecedented time in our history. And I also want to thank the First Nations leaders, non-nursing leaders, but community leaders and provincial leaders who have been working to make sure that preparations are in place to keep those First Nations communities safe. Certainly the efforts have been very effective up to now, and we really applaud your efforts and want to support however we can. So thank you very much to everyone. I wanted to speak a little bit about health links. So as we move from our message of stay home to more of a message about stay safe, the protocols will continue to be adapted, expanded in some ways. And this is also how we are looking at the testing. So starting tomorrow, our community testing sites throughout the province will now begin accepting self-referrals, where you no longer have to call health links before going to a testing site. The testing continues to be directed for those people who show symptoms, whether cold or flu symptoms. But if you have symptoms, you don't have to call health links. You should be going to the online screening tool. And after that, if you meet the testing criteria, you can go directly to a designated testing site. At that testing site, individuals will be asked questions about their symptoms and given information on self-isolating, what that means, how you do it, and while they're waiting for their test results. So as a reminder, there are 16 community testing sites throughout the province, and if you need to figure out the hours of operation or the addresses, you can go online to manitoba.ca/COVID-19. And a reminder that even those with mild symptoms should be tested, and also if you're sick, even mildly sick, you should be staying at home. So some of the symptoms that may trigger you to go for a test is fever, cough, sore throat, shortness of breath, runny nose, fatigue, headaches, skin rashes, nausea, or loss of appetite. Individuals who are tested are reminded that they can confirm negative results online by logging into our Shared Health online portal or by calling the COVID Case Contact Center. Those who test positive will get a call expeditiously from the public health officials to receive more instructions as to what needs to be done after that, and case tracing, contact tracing. Health links will continue to serve a very important role in COVID-19 efforts. So they will continue to be the referral site for the mobile testing, where you can refer if someone is immunocompromised or homebound. We will send somebody out to do the testing within Winnipeg. This was launched on Monday, and it's available by appointment. Operators at HealthLinks will also continue to provide advice to all Manitobans on various health-related concerns, including any related to COVID-19. So I want to say a great big thank you to everyone at HealthLinks. They were under tremendous pressure. They've adapted really well and served a great purpose in this whole COVID-19 effort. As well, digital health team has been working just tirelessly to improve the technological services that are at HealthLinks and made it possible for them to manage a huge influx of calls in a more timely way. So thanks to both for a job well done. I also want to talk about diagnostics. So diagnostics, as we know, many services were postponed for the past month and a half. And now as we loosen up restrictions, we're going to begin scheduling more diagnostics for specifically MRI, ultrasound, and CT scans. And we will start this process by rescheduling some of the postponed appointments over the next couple of weeks. So we've talked about it before, but really looking at as much as we can building capacity, but knowing that sometimes there may be points in this journey where we have to pull back. So right now we're going to make the most of these low case numbers. So we will be but from now till May 22nd, Diagnostics is aiming to schedule 2,000 diagnostic imaging appointments, and those are rescheduled that were canceled previously. They will contact patients directly and provide them with instructions about anything they need to know about receiving the diagnostic test during the pandemic. I will let everyone know that the physical distancing rules still apply in waiting rooms, so they can expect to have that spacing, as well as cleaning and disinfecting protocols also in effect to ensure safety for staff and patients. And I think that's it for that. And I just wanted to also last speak about the alternative isolation centers, give you another update. So we continue to offer this isolation option to people who cannot isolate safely in home, or maybe they don't have a home. So there's different options for different people. There's healthcare workers who have suspected COVID-19. Travelers are still coming back from international travel and contacts of positive cases. So in the last week, we've had 8 people go to the hotel option, and 7 are staying there right now, as well as the shelter program has received 15 referrals, and there's 8 people in isolation right now. So that is my update, and we can open up the line to questions.
Thank you. A reminder to our reporters online, you'll have one preliminary question and one follow-up. Up first this afternoon, from the Winnipeg Free Press, Danielle.
Good afternoon, Danielle DeSouza from the Winnipeg Free Press. I was wondering how and when Manitoba might begin testing people for COVID-19 antibodies now that Health Canada has approved the test.
Right, yeah, so we're part of a national working group on that to have a national approach to it. So there's a couple of things with it. So this testing at first is going to allow us to get an idea on just how many Canadians, how many Manitobans have been infected with COVID-19, what we call a seroprevalence study. So that's going to be important to look at the dynamics of this. It's still early. We don't know whether these antibodies confer immunity or how good of an immunity or for how long it lasts. So those are other things that we're going to have to look at. So we are part of the working group, and we'll start work hopefully soon on those seroprevalence studies.
Thank you. And I was also wondering regarding the cluster in Prairie Mountain. What does the public health investigation tell us about the number of potential infections the cluster could generate? What would be the reproduction number for the outbreak?
Right. Yeah. So I mean, it's tough to have a reproductive number. What probably is a better measure there is what we call the secondary attack rate, the number of contacts that subsequently develop the condition. And so that's too early to tell because we have a number of people still in the incubation period. So we had 25. So there's 10 cases. There's 25 total contacts, 19 of which are still self-isolating. And so we'll have to wait for those isolation periods to end before we really start talking about a secondary attack rate. There could still be cases developed from those 19 that are isolating.
From Global, Marnie.
Good afternoon, Marnie Blunt from Global News. Dr. Roussin, you spoke a bit about the May long weekend approaching and traveling out to cottage country. In the past, the message has always been to avoid non-essential travel. And now, as you were saying, if cottagers are going, there's certain precautions that they should take and don't leave any trace of their visit. Why is there this slight change in language, and is it reflective of the reopening plan and slowly loosening restrictions?
Yeah, that's right. So, I mean, we've in phase one, we've opened up the campgrounds, and so we recognize that Manitobans have spent quite a few weeks with strict precautions in, and so as the weather gets nice, we've opened up some of these events. Certainly, it's not back to normal. We want all those social distancing strategies to be in place. We want people to be aware of not gathering in groups to greater than 10. And what's really vital is that no one who's even mildly ill should be traveling out. And so it's really, really important. But with the reopening strategy, we've moved from that stay home to stay safe. But we do want people to recognize, and I think Manitobans do, is that this isn't back to normal, though. There's a lot of precautions people still need to take.
Thank you for that. And my second question is just about enforcement. Mayor Brian Bowman spoke about enforcement today and the fact that city bylaw is responsible for only in city parks, other in businesses or under public health inspectors, and by default, it seems to be landing on law enforcement. Can you just provide some clarification on who is responsible for what, and who do you expect to enforce public health orders inside the city limits?
Right. So a number of the points there. So the public health inspectors will typically work with businesses. There's workplace safety and health that would work with the employers and employees. We talked about some of the bylaw inspectors in certain areas of the city, and then we're still working with all the partners. Even from the beginning of these orders, Manitobans have stepped up and have followed advice. They've followed orders, and and our numbers show that. And so enforcement is important. We need to have that in place. I think it's might be even more important as we start to reopen things to ensure that people are following things, that people aren't just getting right back to normal. So we're still going to work with a number of partners just to clarify a lot of those things to ensure everyone's on the same page on who's going to be responsible for enforcing what.
From the Brandon Sun, Bud.
Yes, Bud Robertson at the Brandon Sun. So, Lanette, with removing the referrals for the testing sites, is there a concern regarding a sudden influx, and how are you preparing in terms of manpower and that sort of thing?
Yeah, so all the testing sites, the leadership in the regions are aware that this is coming. And I guess it depends. It could be an influx all at one time. We're hoping it will be spaced, and it's a pretty quick visit. It's mostly in and out. So if there is a bit of a lineup or a wait, hopefully that will move along pretty quickly. But they should be all prepared that this is how we're going to do it from now on. It's just an extra step we don't really necessarily need to take.
Okay, thank you. And Dr. Bruce, regarding the state of emergency, I believe it's being deadline soon. Is it being lifted, or what's the situation with that?
The state of emergency. So that's my I deal with the public health orders with it. So we'll still be reviewing the state of emergency and probably have more information on that. But that's for now. I focus on the public health orders, which are separate from that state of emergency.
Good. Thank you both.
From CJOB, Diana.
Good afternoon, Diana from 680 CJOB. Kind of with respect to how the messaging is changing again from stay home to stay safe, is it safe to have a couple friends over to your backyard this weekend for the long weekend, say? Obviously not having certainly more than 10, but what is the kind of safety ranking on that?
Yeah, and so I mean, this is we want Manitobans to make informed decisions with all of these type of things. So certainly meeting people outdoors, physically distancing, then we're talking about lower risk type activities. Keeping those numbers below 10, and again, looking out for each other. No one even showing mild symptoms in themselves or anyone at home should really be going out meeting anyone, even if it is outdoors or with physical distancing. So if everyone's staying, keeping close eye on their health. No one being ill is heading out, then sure, meeting up with a couple people outside, physical distancing, then this is a lower risk activity.
And just as a follow-up, with respect to the cluster in the Prairie Mountain Health Region, has anyone from that cluster been considered recovered yet? If not, when might we kind of start seeing the first recoveries from that? And has anyone from that cluster been hospitalized?
There's one in hospital that's related to that cluster, and then there are three of the 10 cases are recovered.
From the Winnipeg Sun, Scott.
So Scott Billick here, Winnipeg Sun. I'm just wondering about the active cases. The number hasn't really changed much, and the recoveries haven't gone up a whole lot lately. Is there a reason for that, or is it just because most of the cases are still relatively new, or trying to find out about those recoveries?
Yeah, so the recoveries are largely a function of time. And so when we don't have a lot of cases, you're not going to have a lot of recoveries. So it's going to take at least 14 days for a new case to be recovered. And in sort of the last 14 days, we've had, I think, we've had under 2 cases per day on average. And so we're just not going to see a lot of recoveries each day either, because there hasn't been a lot of cases.
Thanks. And just for a follow-up, how many, I guess for Lanette, was HealthLink becoming an artificial barrier for people when it came to getting tests? Like, are you expecting significantly more people showing up to testing sites now? Or I guess what's the reason why by kind of eliminating the so-called middleman, I suppose?
Yeah, that's a really good question, Scott. So we put HealthLinks in as a step in the process because at the beginning, we had very select criteria as to who would go and maybe who wouldn't go for testing. And now that we've really expanded that out so broadly, anyone who's feeling sick should go for a test. We've built up that testing capacity as well. And we've also built up the access to those testing sites. So no, I wouldn't say they were a barrier. They were answering a lot of calls in a timely way and did everything that we would have asked for them. But now it's just at the point where if you're sick, you go. You don't have to call HealthLinks. You just have to go get tested. So it just seemed like a more convenient, practical thing to do. But no reflection on the great work that HealthLinks has been doing.
Very much. Thank you.
From CBC Radio Canada, Thibault.
Good afternoon. Actually, my question is maybe for Dr. Roussin. We've seen a lot of pictures online with the crowded, overcrowded buses, and I'm just wondering why not making wear a mask in public transportation mandatory in Manitoba?
Yeah, and so I think that getting to the basics is always important. We want to ensure that we can do physical distancing as much as possible. Lots of hand washing. Really important that people who are feeling ill are staying home. Certainly not on a bus. And so it's really vital for our reopening strategy that those steps be taken. The wearing a mask is, it's an added feature to those things. It's not a substitute for those things. It doesn't protect the person wearing it. It only protects the people around them. So it's certainly an option for people. And as our reopening strategy moves, we're always looking at new type of initiatives, practices, but right now we don't have it on our sites to make wearing masks mandatory.
Okay, and my follow-up would be, do you have any knowledge regarding people who have maybe been tested multiple times, and if so, what's the proportion?
Okay, yeah. So individuals that have just had multiple tests. So no, I don't have any information on that. It is something that could be found out. Typically, when we report nationally, we report on people tested with it, not counting the multiple times that an individual would be tested. But I don't have specific information on that. My sense is it's not a large number.
Okay, thank you.
From CBC Manitoba, Aidan.
Hi, Aidan from CBC News. My question is for Dr. Roussin. We've seen the creative use of day camp rules by at least one Winnipeg school division to try and get some students back to learning over the summertime, especially kids who are at risk of falling behind academically. So I'm just wondering, what do you make of this approach, and what's your message to that division and any other divisions that might be using this approach or interested in it?
Yeah, I think that as we learn more about this virus, we found that children are underrepresented in cases, and probably not a huge proportion of the transmission of this virus. Certainly they develop COVID and rarely can have severe outcomes, and they sure can transmit it, but they don't seem to be the large the driving force behind the epidemic. So that's why you're seeing in a number of jurisdictions that even schools are going back. And I think that at a public health approach that can be feasible. So I think using the day camp rules to get offset some of the childcare issues, doing so in a safe manner with all those precautions we always talk about: hand washing, sanitation, no one coming in there who's ill, physical distancing. Then I think it's safe and a reasonable approach.
Thank you. And my follow-up is for you as well, Dr. Roussin. We heard from at least one family who said that they had a loved one in hospital who was deemed palliative, but they were not able to see that family member in her dying days. So can you just clarify the exceptions for visiting family members who are seriously ill or dying in hospital, and what guidelines are staff getting on that?
So we do have visitor guidelines, and we do know of that story, and I personally want to send my sincere condolences to that family. We are investigating a little bit more as to what happened, because we do have exceptions in our visitor guidelines for compassion, visiting for compassion. And really, you know what, the purpose of the guidelines is to make sure that we minimize the risk of spreading COVID in those high-risk areas like hospitals and long-term care facilities. But I've said all along, and I will continue to say it, is that we're not dealing with widgets, we're dealing with people, and we have to keep that person-centered approach to what we are doing, even in the midst of a pandemic. So the exceptions would be for the visitor restrictions is if there's someone who's palliative and needs their support people around them. If there's a woman who's having a baby and needs a support person, if there's a child who needs their parents for emotional support as well as some physical support, those things need to be taken into account. And there's screening in place, there is PPE available, there is all, it's really, we can't, it was never the intent to make a blanket statement. There's always going to be some room for clinical judgment and individual situations that have to be evaluated. So that is what should be happening at the unit level and the site level. The guidance is the guidance, and we do want to keep visitors to limited, but we also want to make sure that we take care of people.
From the Canadian Press, Steve.
Steve Weinberg from the Canadian Press. Ms. Siragusa, I just wanted to double check. Prior to today's announcement about being able to go directly to for testing at a testing site, a person could be referred either by a health nurse or a physician, correct?
Yeah, that's correct.
Okay. And is there any concern? I know you're only sort of processing tests at about half the capacity. Is there the capacity to deal with what might be a surge if people have the right to just show up at a clinic?
In terms of at the clinic, I think there's capacity, and as you know, we also have at least 4 drive-through facilities, so certainly there would be capacity there, potentially a wait if all the surge comes at the same time. But in terms of testing, we are set for about 2,000 tests a day, and we're not doing anywhere near that. So again, it's only for people if they're symptomatic. There's no real benefit to testing people who don't have symptoms. But yeah, we will accommodate the rush if it comes at certain times, and maybe we we'll learn as we go. If there's some ways that we can schedule a little bit differently and manage the flow throughout the day, we can certainly look at that.
From CTV Winnipeg, Michelle.
Hi, it's Michelle Gerwin from CTV Winnipeg. This question would be for Dr. Roussin. I have a question about airborne transmission. What does the current evidence say about airborne transmission, and how do you interpret that into recommendations to community health care providers like dentists?
Right. Yeah. So the predominant form of transmission of this virus is through large droplet spread. So when people are coughing or sneezing, large droplets, and that they quickly fall to the floor, and so this is typically that 2-meter distance. So that's the predominant spread. That's what drives this outbreak. Aerosol generating medical procedures have been shown to aerosolize the virus, and so certain activities with endotracheal intubation, certain medical procedures that could potentially aerosolize that virus, then it could keep those very tiny droplets in the air longer and could be transmitted that way. So that's why in certain procedures that we consider being aerosol generating is why we use those N95 masks, but only during those times.
Okay, thank you. And another question about traveling to the cabin. Is there any difference between going to your cabin interprovincially, like if you need to cross the border, or are you just mostly speaking about going to the cabin within the province of Manitoba?
Yeah, right. So we have our the public health orders that require the 14-day mandatory isolation period for people leaving and coming back into the province. Certainly, there's an exclusion for people with routine travel in neighboring communities, such as attending your property there. So the message is when you're leaving the province, there really should be the leave no trace type travel, where you fill up at home. Bring all the stuff you need. You're not visiting local areas. staying at the cabin, not large groups with others, and then coming straight back, and then certainly not traveling if you or anyone at home is ill.
Thank you. We have some time left today, so if our reporters have any further questions, please ask them now.
Just a quick follow-up. It's Diana from 680 CJRB. Dr. Roussin, with respect to the workplace cluster, you're saying 10 cases today. Yesterday, the release said there were 11 cases associated with that workplace cluster. Can you just clarify?
Yeah, so one was a contact that actually tested negative. So we're not going to count it as a case. In those kind of circumstances, we don't change the way public health deals with them, really. They're still going to be isolating for 14 days, and if anything gets worse, probably test it again. But that's the reason for that change. It was just a negative test came back.
Okay, so it was a probable positive until the test results came back, and now it's deemed negative.
That's right. Yeah, it was a close contact, and so we just considered them a case, treated them as a case. But once the test came back as negative, we wouldn't report it as a case, although that person will still be self-isolating for the 14 days.
Okay, thank you very much.
Hi, Aiden from CBC. Oh, sorry. So I'm just wondering, what conditions are you looking for right now? Recommendations, of course, for people who are over 65 or at higher risk are still to stay home as much as possible. And I'm wondering what conditions you're looking for when those recommendations can be used for that group.
Yeah, so I mean, we're we're going to be dealing with this virus for some time, and we know that 80% of people who are infected with it recover just at home, usually with relatively mild symptoms. We have severe outcomes in a small but predictable amount of people, but a huge proportion of that severe outcome are in those groups that we talk about, those over age 65, those with underlying medical conditions, and those with immune compromise. So as we deal with this virus, we really need to protect those vulnerable groups because we just need to avoid these severe outcomes. And so when will that look? It's part of the same the presence. If once we can be sure that we're not seeing a lot of community transmission for a sustained amount of time, we can start discussing that. But it's uncertain right now when and if that will be around. If prior to having any treatments or any vaccine. So we just have to follow what the numbers show us. But there's the focus, especially right now, this early in our phase of reopening, is to protect those most vulnerable.
Dr. Roussin, Robertson, Brandon Son again. Some medical professionals have talked about people still being contagious after 14 days and affecting people. What are your thoughts on that, ending at 14 days and not being extended further?
Yeah, so people who are 14 days after the onset of symptoms and asymptomatic, we're going to consider them recovered. Very, very unlikely that they're going to be transmitting virus. Where the confusion comes in is often for weeks after you're recovered, you could test positive with the test that we use, a molecular test. It only searches for remnants of that virus, the genetic material of the virus. So when you look at studies that compare testing with the PCR, the molecular test, compared to a culture, which actually measures viable virus, people who can be infected, you find after 10 days of symptom onset without symptoms, we don't find viable virus anymore. So there's a lot of confusion with that, because if you test them using the molecular test that we use, they could still be testing positive weeks after they're recovered, but they're not transmitting that virus.
Thank you.
Danielle here from the Free Press. Dr. Roussin, I just wanted to follow up on the antibody testing. Who might be eligible for this in Manitoba?
Yeah, so it's a little early right now. It depends on, on our approach and what we find out about this. So right now, it's going to, a seroprevalence study is more of a random and somewhat can be a targeted campaign just to give us an idea of the proportion of Manitobans that we believe have been infected. Once we have an idea that whether or not this confers immunity on somebody, then we might be able to utilize that in certain other other strategies. But that first step really is just to try to get an idea of the magnitude of infection, right? Because we're going to have people with with symptoms that maybe did not attend for testing, people with very mild symptoms that did not recognize it, and then people without symptoms who were infected. And so we really want to find out what the actual proportion of Manitobans are that are infected by this. It'll guide further work.
Thanks. I do have another follow-up question. I was just wondering, in opening up testing and removing the health links steps, are you concerned that people who are symptomatic are possibly avoiding going for testing due to fear of stigma or fear of potentially testing positive? And is this a concern for a public health response?
Yeah, for sure. Right from the very beginning, we talk about fear and stigma can drive an epidemic, and so we continue to get Manitobans try to get credible information, knowing that many people will have mild symptoms with this. But it's really important to identify those cases because we're going to isolate them. We're going to have contact investigation. And so this is this testing and just as important, the staying home when you're ill is really everyone's role. And as we talk about this, we really need all Manitobans to be on board with this, right? We need employers to understand that we don't want employees coming to work sick. So you have to give them viable options to stay home when they're sick. If people are contacts of COVID-19, we don't want them in the workplace. We want them self-isolating. So therefore, employers need to be able to provide reasonable options for people to self-isolate while they're doing so. So it's really going to take that all the Manitoba approach, and I think our numbers show that that Manitobans have done that. Manitobans have stepped up, but you're absolutely right. Stigma can be an issue, and we've seen examples of it, unfortunately. But we just want that credible information, and we can deal with this virus. We've already shown it, and so as we reopen, it's going to be really important that we identify cases as quick as we can.
Hi, Aiden from CBC News. My question for Dr. Roussin. Is the patient, the one patient who is in the ICU, can you say if that patient is linked to the Prairie Mountain cluster?
No, that's not related to the cluster.
We have time for one more.
Danielle here from the Free Press. I'll take that last question. I was just wondering, for folks who are attending for diagnostic procedures as they are rescheduled, will they also be subject to verbal and temperature screening before entering facilities?
Yes, they will. If it's a publicly funded facility where it's happening, they should be all the same, and the physical distancing as well.
And that concludes today's media briefing. Thank you.